Good morning, everyone. Welcome to our very first Facebook Live hosted by Restoration Health. Please bear with us because technology is a little dicey because, we're doctors, not technologists. But thank you so much for being here today. I'd like to welcome my brother and panelist, David Kaplan, who 5 years yesterday was yesterday we celebrated 5 years since he survived a massive stroke, and I couldn't be happier than to have him join us today to tell his story. So, brother, what do you say?
Glad to be here. Glad to be here. Thank you for passing the mic over, so to speak. So 5 years ago yesterday was, as I said on Facebook, the worst day of my life. But in some respects, the best day of my life because I experienced several miracles that day. So I guess I'll just launch right into the story. Or did you want to share your presentation first?
Yeah, before you begin, I just want to kind of give people some background about strokes and the different kinds of strokes that exist. So I'm going to share my screen, and again, bear with me because technology can be a little tricky here. Okay, and view. Why isn't this giving me presenter view? Slideshow. Okay, so there are two kinds of strokes. There's ischemic strokes, which are the most common. About 87% of all people who experience stroke experience an ischemic stroke. And then there are hemorrhagic strokes, and those are generally more bleeds in the brain. An ischemic stroke is, as it says here, when the blood supply to the brain is obstructed, so it causes a lack of oxygen to get to the brain, and then different parts of the brain die as a result because they're oxygen deprived. A hemorrhagic stroke is when a weakened vessel ruptures, and that's usually an aneurysm or if you have an arteriovenous malformation. And the most common form of hemorrhagic stroke is from high blood pressure. David actually suffered from an ischemic stroke, and I'm going to let him tell the story, and I've got some pictures up here of the actual accident. So David, why don't you start with your story, and then I'll butt back in a bit.
All right, sure. So at the time I was 44 years old. Camera's not on me. Can you hear me?
I can hear you. I have the pictures up.
All right, that's good. So I was 44 years old. I was leaving my office in Midtown Manhattan, got on the Lakeland bus. My right arm was completely numb, felt like it was asleep, really nothing more than that. And by the time I had arrived in Parsippany, my right leg began to tingle. My right arm was completely dead. I had zero control over it. But I wasn't thinking stroke. I was just thinking maybe I was exhausted or something else was going on. So I got behind the wheel of my Jeep and I proceeded to drive home. And when I got to Fanny Road, my car veered off to the right and hit the curb. And I thought to myself, well, that was a little strange. But I rectified it and got back on the street, continued driving. And then I turned up Essex Avenue and I crested the hill. And quite frankly, that's the last thing I remember until I was woken up. And as you see in the picture here, the red pickup truck was hit by my Jeep, which is on its side in the front part of the picture there. So I'd actually hit both the red pickup truck and the white van in front of it and then rolled my Jeep. And then some bystander came running up to my Jeep, stuck his arm in my sunroof, tapped me on the shoulder and said, "Hey, buddy, can you get yourself out?" And at this point, I had completely lost my ability to talk. I had zero speech. So I guess I mumbled to him, and I got my seatbelt undone. I crawled out through my sunroof, and I was sitting on the curb. And, one of my firefighter buddies, Natalie Pisarcik, had come running up. She was walking down Main Street and heard the crash. A lot of people said they heard it because it was very loud, as you can imagine. And she says, "Dave, are you okay?" And I couldn't speak to her either. I was just mumbling at that point. So I was sitting on the curb, and I noticed my bag that I carried my laptop and my iPad in was sitting in the middle of the street. So not thinking, I got up and walked over to the bag, picked it up, and carried it back to where I was sitting down in the middle of the street. She's like, "Dave, what are you doing?" I was like, I couldn't talk to her, but I was thinking to myself, nothing. I had a wreck, and, it is what it is. So lo and behold, the wreck occurred on Essex Street, right across the street from Dr. Demaire's house. And Dr. Demaire is a critical care physician who operates out of Chilton Memorial Hospital. And he noticed that I had no use of my right limbs. My right arm, my right leg were not functional. I couldn't talk. So he realized I was having a left side brain injury. He walks up to the captain of the Kiwanis ambulance squad and says, you know what, don't take this guy to St. Clair's, get him to Morristown. I'll call over there, make sure their neuro unit is on standby and they know you're coming. So that was miracle number one. So I got to Morristown, and from that point, things got hazy for me because it was like a flash. You know, I was brought into the emergency room. I was on a stretcher. They were doing all kinds of tests, tons of doctors and nurses running around. My wife, Amy, you, my sister, and my mother were all there, and you guys were given options by the doctor. I couldn't talk, so I didn't even know what the options were. And from that point, I'll let you tell the story on my treatment because, you know, I was kind of out of it. But, you know, go back to the previous picture with the red pickup truck. I will say that after I was in the ICU for 4 days in a regular recovery room for another 4 days. And then when I got before I got out of the hospital during that 8-day period, the owner of that red pickup truck came to my house. I guess he had found out where I lived from the police department just to check on my well-being and make sure that I was okay. God bless the guy. He had just had that pickup truck completely repaired and repainted. It was basically brand new before I re-wrecked it for him. Yikes. So if he's listening today, I never got the chance to meet you or thank you. But first off, my apologies for re-wrecking your truck. But thank you for showing concern. It was very nice of you. So from this point forth, I'll hand it over to you, Lauren. You can tell the story of my treatment.
Yeah, and I think, didn't one of your firefighter friends' wives just have a baby? And didn't she also, like, just walk down the street?
No, that was Amy Melgard. She didn't have a baby, but she lived on the corner opposite where the accident happened. She also heard the crash, and she came running over, and she was tapping me on the shoulders like, Dave, are you okay? And, of course, my response is, you know, just mumbling. Yeah. But, you know, it's amazing how many people came out. I've been a member of the fire department at that point for close to 20 years. And just, you know, it's a small town where everybody knows everybody. So word got out very quickly about what happened. Everybody came over, showed concern. At the hospital, I felt like there was 100 firemen there to show support and be with me. So it was truly an amazing show of support from everybody. There you see some pictures of my truck. Both of the airbags were deployed. The roof was crashed in where it rolled. Yeah. I guess miracle number 2 is that it rolled to the right, not to the left, because if you look to the right side of your screen, you see how badly dented the roof was on the left side. Had that been the driver's side, I probably would have sustained more severe head injuries, you know, externally and internally, besides just the stroke. So I'm going to first show everybody, and I apologize if it looks like I'm not looking at the screen, guys. I'm trying on my cell phone to find comments, but I'm failing miserably. This is my first foray into this technology, so forgive me. We will go back and get your questions, but I want to show you where in David's brain or where the stroke occurred, because David mentioned that he was mumbling, and there's a reason for that. So you see I've got a big red square around the common carotid artery. Those are the arteries that go up your neck and feed the circulatory system of your brain. It's called the circle of Willis, or Willis, depending if you're German or not. So, and then you see the middle cerebral artery. So what happened with David is he had a carotid dissection. Basically, if you picture the carotid artery like a straw, and if you ever had a straw and you peeled the top of it off or down, picture one flap of that peel in that straw folded over into the straw so that you can no longer drink out of the straw. So that essentially stopped the blood flow to his brain and threw a clot into his brain. Now, fortunately, he did still have blood flow from the other side of his neck, the carotid, so it didn't shut down, you know, his brain fully. But the middle cerebral artery, and here's another view of it, feeds the top of the brain. And David had a stroke on his left frontal lobe, which controls the right side of his body. So by the time I had showed up at the hospital, David was completely paralyzed on the right side of his body and had what's called Broca's aphasia. So you can see in this slide, this is the area of the brain that controls
your ability to form words. There's actually two areas. Wernicke's area, you can still say words, but then you aren't able to put sensible sentences together. Like people who have Wernicke's aphasia might say dog, tree, house, car, and think that they're speaking perfectly normal, while people with Broca's aphasia can't speak at all. So I'm going to stop sharing my screen for a moment and go back to us. So I showed up at the hospital, and at that point, you know, we had kind of heard a rumor. Jimmy, my husband, had gotten a phone call from one of the firemen that they thought David had a stroke. And I was on the way to the hospital with my mom and thought, he's 44 years old. There's no way he had a stroke. He's, as you can see, he's in good health. He works out. He's not overweight. He really didn't have the typical profile of somebody who might suffer a stroke. So when we got to the hospital, as I said, he was paralyzed on the right and couldn't speak. He couldn't form words, but he was completely cognizant. And I knew this because I was by his hospital bed with my sister-in-law, Amy, and I made a joke to David. So typically of the siblings in our family, David's the take charge one. And I said to him, today the role of David Kaplan will be played by Lauren Kaplan. And he laughed. And at that point, I looked up and I said to the doctors, has anybody told him what's happening? Because he's fully cognizant. He can't speak. He can't say what he wants to say. And I also saw him put his hand up to comfort his wife. And they said, yes, we told him. So at that point, so in the cascade of miracles, aside from Dr. Demare happening to be home at 3:30 in the afternoon and David crashing his truck in front of an ER doctor's house that just happened to be home, there was the good citizen, I don't know if you said this, who knocked on his sunroof, because that's how you actually got out. You came to long enough to crawl out your sunroof. And when the ambulance came, Dr. Demare said, take him directly to Morristown Memorial. Don't take him to the hospital down the street. I will page ahead for the neurosurgeon, and these are the tests that he needs to have within this window, because if you get a stroke patient to the hospital within 4 hours, the likelihood of being able to reverse many of their symptoms is very highly probable if they get this stroke medicine called TPA. It's basically a declotting drug. And of all of the miracles that we refer to in the cascade of miracles, yes, David flipped and crashed his truck, but because he did not sustain any internal bleeding in that accident, they were able to give him TPA. And they actually fed it into his line while I was standing there. And the nurse said, okay, David, you know, press your right foot as if you're pressing on the gas pedal. And he got a little movement in his foot. It was really exciting. But they still wanted to go in, and they had done some brain image scans, and the doctor said, for me to really be able to help him and you know, shorten the severity or long-term effect of these symptoms, I need to be able to clear the clot. So, you know, at that point, we said to the doctors, okay, you know, he's like, we're going to go in, we'll come out, we'll tell you what we're going to do. We need to kind of fish around and make sure that we're dealing with, you know, we think it's just in this one primary area. So we were like, okay. And I had said to the doctors, you know, whether you think he's conscious or not, do me a favor, please, no cross-talking while he's seemingly unconscious, because he's very bright and he works in medical marketing and we don't know what the subconscious picks up. And I got to really give it to your doctor, because he didn't look at me like I was some crazy acupuncturist at that point. And by the way, I wasn't even licensed yet. I was still in acupuncture school, and I just had neuroanatomy, which was why I knew exactly where in the brain this was taking place and what the side effects were. So the doctors went in, and you were saying you felt like there were about 100 firemen there. There were, because the doctors came out and they said, okay, we're here for the family of Kaplan, and about 100 people stood up. And the doctor went like, oh, because, HIPAA, you're not supposed to have these conversations. And I said, don't worry, we're all family here. So, he said, look, this is the situation. And I'm going to pull back my screen again, share my screen so that I can explain with my mouse where we were. So the doctor said, and it was the neurologist, the surgeon, and me. And he said, what I really want to do is go posteriorly. You see this where my arrow is, go up through the posterior lobe and clear out the clot, which is sitting right here, which would have been, he said, ideally, I'd like to go through the carotid. But my concern is that the vein is so destroyed that there's a 70% chance he will bleed out and die. So he said, so then, the other doctor said, well, why don't we try posteriorly? So at that point, our family got together in a separate room and, talked together. Time was certainly of the essence, and said, my sister-in-law, Amy, who's next of kin, embraced the family and said, we should take the least dangerous approach. And so I said to everybody,
take your time, I survived.
I know, thank God. No cliffhanger here.
Spoiler alert.
The David we knew going into this may not be the David we know coming out, and we need to be prepared. This is a very severe stroke. So we agreed on the less severe approach. The doctors go in. God, it felt like hours. Who knows how long it was. And the neurosurgeon came out with a very stern look on his face. And I thought, well, but prior to that, I was doing a bit of praying, and I just said, I don't want to lose my brother, but don't make him live a life he would not want to live. And then the doctor comes out, and there's the real, oh, you know what moment. And he said, his blood pressure is dropping. We need your permission to go the other way. So now we've got a 30% chance that we're going to see him alive at the end of all of this. So no cliffhanger, because you see he survived. And the doctors came out. Everything went really well. And they said, the next 24 hours are critical. We have to watch for brain swelling. If his brain swells too much, we're going to have to do a craniectomy where they open part of the skull to drain the blood, which is very scary, but you can heal from that, and it's actually a better thing to do. So they came out, and the doctor was like, you can see him now, and we were shocked. So we went up, and my oldest brother and David's wife, Amy, were the first to visit David afterwards. And I hear my brother shriek. We're criers in this family, in case you haven't figured that out, or at least me and my oldest brother are. And I thought, oh no, like he survived the surgery and just died in front of Mark. And he was able to say a few words, not very many. And you had a tic, your face was still drooping, you had some limited movement, but the doctor said it would be a process. The next day you had more words, and it was funny, actually. He even gave one of the physical therapists a run for her money. Their PT and the speech therapist were there at the same time. She hands him a comb, and she says, David, do you know what to do with this? And he picks up his foot and he starts scratching his foot, and he says, just kidding. So you had your sense of humor back, which was great. But speech did take a while. I will tell you, Facebook was really powerful that day because, well, we didn't post it on Facebook. But then word started getting out, and lots of people were reaching out with questions. So we did say, this is what's going on. And I have to say, as a community, you all really came together and offered a lot of prayers, a lot of visits to the hospital. They actually, somebody from the hospital reached out to us. There were so many people inquiring about David that they thought he was someone famous. The PR people reached out to us. But, one of the things I want to talk about, David, aside from the miracle of your survival and all the great things, not crashing in front of an ER doctor's house, not sustaining any injuries, getting to the hospital in time, getting TPA, having an amazing surgeon, having great follow-up care, all of that, blessed beyond measure. What were you feeling before it actually happened? Because I know, people don't know when they're having a stroke. What were you feeling?
As I said, I had no clue that I was having a stroke. The numbness in my right arm, or the lack of complete feeling in my right arm, was strange. But like I said, it just felt like my arm was asleep. Like everybody gets that, whether you're sleeping on it the wrong way or what have you. You reach over, you feel one hand with the other, and you can't feel it. It just feels like it's asleep. And that's what I felt while I was driving home. I had no clue that there was anything going on in my brain. And what's interesting is, as you said, I suffered from a dissected carotid artery. They call it a young man's stroke. You can get that from painting a ceiling. You can get it from bad chiropractic work, a bad massage. I think, and this has not been proven, but I think I got it from doing T25, which is an aggressive workout. I had been working out for well over 30 years. Exercise was always a mainstay of my daily routine. And I had just started doing T25 probably 2 weeks prior to that. And I would come upstairs, my face would be beet red, I'd be all sweating, and Amy would look at me, she's like, Dave, you don't look good. She goes, I've seen you work out for years, you've never looked like this before. I'm like, no, it's fine, just got my heart rate up, it's no big deal. But I think through whether it was the aggressive movements that I was doing or the heart rate or a combination thereof, that's what led to my dissected carotid. And they say that it can take up to a week after your carotid dissects before you suffer a stroke or feel any symptoms from it. So it may have been, festering, for lack of a better word, for probably 3, 4, 5 days before I'd actually had a full onset stroke. But as far as the day of what I was feeling, there was nothing about it to me that rang stroke. At the point that it happened, I didn't realize I couldn't talk because I was in the car alone. I didn't realize I had partial facial drooping or anything like that because I wasn't looking at myself. I was watching the road, So I realized that I couldn't lift one arm, which is a definite sign of a stroke, but I didn't attribute that to having a stroke. So all things considered, I was clueless, absolutely clueless.
And you mentioned that, at least to me on many conversations, like you felt a little bit of tingling in your arm. And, prior to crashing, you actually said that you kind of you had what you thought was just a moment where sometimes you're driving and you're driving. And so you kind of forget where you are and where you're going. And you said you kind of swerved and was like, whoa, I guess I wasn't paying attention, not realizing at that moment that you probably did have a very brief blackout.
Yep.
Before you.
Yeah, about a mile before my crash, my car veered off to the right and hit the curb. And I suddenly corrected it and went back to the left. And I thought to myself, that was really weird. My car usually doesn't veer off to the side of the road. So I just kept driving. And then when I crested the hill on Essex Street, I completely blacked out, hit those two parked cars. My Jeep rolled. And that's when the individual came over, tapped me on the shoulder through my sunroof and said, hey, buddy, can get your seatbelt undone. And I woke up and I was like, on my side, yeah, I guess I can. I get my seatbelt undone and crawled out through my sunroof. The rest is history.
Yeah. So I'm going to, I'm going to attempt to share my screen again because, something that's really important for, sorry guys, I'm a little technology challenged here. So let me share my screen. What I want people to know is how to recognize the signs of stroke. The acronym is FAST. So if you see somebody with facial drooping, say, lift your arm, lift your left arm, lift your right arm. If they can't, that's a sign. Ask them what day of the week it is. See if they're able to say their name. And most importantly, call 911 right away. As I mentioned, the first 3 to 4 hours of care post-stroke are absolutely critical. For the kind that David had, he felt some numbness and tingling down his left arm. So, that's not something you should ignore if you're young and healthy. Certainly, if you have any heart issues to begin with, if you're somebody with high blood pressure, high cholesterol, you should never ignore those signs. For hemorrhagic strokes, they say when you're having a brain bleed, it's the worst headache of your life. Like, it supposedly feels like a very sharp stabbing pain in your in your head. So if you're ever experiencing something like that, that's atypical of a headache, that's another time to get yourself to an ER, or better yet, call 911 in case it is an event, and then you don't have to worry about crashing your car. In terms of preventing strokes, I mentioned blood pressure. So, if you're somebody who suffers from high blood pressure, you need to get that unchecked. You need to exercise. You need to lose weight. Losing 10% of your body weight takes a lot of tremendous pressure off your heart. Drink alcohol in moderation. If you're a chronic drinker, if you're somebody who does a lot of drugs, there's a lot of, I call them young people, but, people in their 50s. When Luke Perry had a stroke, this is 90210. This is our generation now. And we feel too young to be experiencing these things. I know 3 other people actually, that we went to high school with who have since had a stroke. I just found out a college friend of mine had a mini stroke. So these are, things you got to pay attention to. If you're a smoker, it's time to quit. And we can help you with that here at Restoration Health. But also, if you're diabetic, unfortunately, over time, your blood vessels, high sugar starts to break down and ultimately can compromise your blood vessels. So that can cause stroke. Atrial fibrillation, if left untreated, can cause stroke. But you can get treatment for all of these things, and you can hopefully prevent stroke. I want to try and see if I can address any questions or comments on Facebook. Again, I'm sorry, and I think there's a bit of a delay, so it makes it hard for us to see what's happening. I see lots of watchers, but I can't see comments. David, are you able to see comments?
No.
In your feed?
No.
If you have any questions, let us know. I think I'm still sharing my screen, so sorry if I am, because my screen's a mess. So let me just stop that. This is not fun, people. I'm sorry. A lot of high pressure here when you're not a techie. Wait. Where is here we go. Stop share. Sorry, everybody. I just made you all very dizzy. All right. I don't see any questions. So, David, you got to look up. People are watching you.
The comments, I didn't see any.
I know. I was looking too. But I just wanted to thank everybody for tuning in. I'm going to post the PowerPoint in the comments if it lets me. I will also post, this will be posted on Facebook, so anybody who didn't see the accident can see it. And most importantly, I want to thank Dr. Demare, the staff at Morristown Medical, Dr. Benitez, and really the entire Boonton Fire Department, and all of our friends and the town of Montville who came together to support us. It was really incredible. And I hope that if you take anything away today, that you can recognize the signs of stroke and that you act fast. Call 911. It's facial drooping, inability to lift arms, slurred speech, time. Call 911.
Yeah, when you say facial drooping, think Bell's palsy. If you've ever known anybody with Bell's palsy, that's basically the droop that you're looking for. If somebody has a stroke. On top of all the people that you thanked, I of course want to thank you, Mom, my lovely wife Amy, and the rest of my family, as well as the entire Booton Fire Department and everybody else that you mentioned, the doctors, the staff at the hospital, Kiwanis Ambulance, everybody that was there that day and in the ensuing days. Laura, if you want, you can also post up the comments that I put on Facebook probably 5 days after my stroke, because I think it's a good example of, was it Broca's aphasia that you were talking about?
Yeah.
With my inability to speak. I basically outlined what I was able to say. That's not what I was able to think. I was thinking clearly the whole time, but I just couldn't put the words together in a format that other people could understand. So I spelled them out in a Facebook post that I think really makes sense. So if Laura wants to post that, she can.
Yeah, I will.
Yeah.
It starts with oomph a luffy because he couldn't speak. And then it was, I got in a wreck with my truck. And then I got blacked out, had a crash with my Jeep, and the mailbox took me away to the restaurant. So,
doesn't make sense to you?
No, no. So, well, we're really grateful. Thank you, everybody, for tuning in. And again, I'll get better at this from a technology perspective as time goes on. But we really appreciate you joining us. And if you want any more information, actually, there's quite a bit I posted on our blog at feelgreathere.com. There's a lot of information about stroke, about acupuncture and the treatment for stroke. I did used to treat stroke patients at NYU Lutheran. That's where I did my externship. Obviously, having a brother have a stroke creates a strong interest in brain injury. And, if you're looking to quit smoking, we can help you with that too, because your life matters and you've got big things to do. Have a great day. Thank you.
Take care.